Welcome to the Daily Current Affairs by CivicCentre IAS, where we try to discuss the important articles from the Hindu, the Indian Express, and the PIB from the UPSC CSC Prelims perspective. Displayed are the list of articles which we are going to discuss in today's video. The first article of the day says that in a significant public health achievement, India has officially declared free from trachoma by the World Health Organization. Significantly, this milestone comes after years of dedicated efforts by the government to protect its vision of millions, emphasizing the importance of healthy eyesight for every individual. In this context, let us talk about various aspects related to trachoma. See, trachoma is a serious eye disease caused by the infection with chlamydia trachomatis, primarily spread through eye secretions of infected individuals. Notably, it is transmitted via close physical contact, especially among mothers and children, sharing personal items like towels and pillows, houseflies carrying the infection, and coughing and sneezing. Furthermore, environmental risk factors include poor hygiene, overcrowding, water scarcity, inadequate sanitation, and impact on children. Know that children are particularly vulnerable, facing repeated infections that cause scarring on the inner eyelids. So, this can lead to trachiasis, where the eyelid turns inward, causing painful rubbing of the eyelashes against the eye, eventually leading to visual impairment or blindness if untreated. Notably, individuals may need to endure over 150 infections to reach severe blinding trachoma. If we have to talk about India's fight against trachoma, so in the 1950s and 60s, trachoma was a significant issue in India, especially in the states like Gujarat, Rajasthan, and Uttar Pradesh, with over 50% of the population affected. Then by 1971, trachoma caused 5% of blindness in the country. So, India implemented several interventions through the National Program for Control of Blindness and Visual Impairment, including firstly, National Trachoma Control Program of 1963. With WHO and UNICEF support, it focused on surgery for advanced stages, antibiotic distribution for clearing infections, facial cleanliness promotion, and environmental improvements like better water access. Then integration into national programs in 1976, through which trachoma control efforts were integrated into broader health programs, ensuring sustained resources. Lastly, WHO Safe Strategy, which included surgery, antibiotics, facial cleanliness, and environmental improvements. Speaking in the global context, India joins the countries like Nepal and Myanmar in eliminating trachoma, but it remains a challenge in 39 countries, affecting 1.9 million people globally. The second article from the PIB, which says that through Tele MANAS, over 14.7 lakhs calls served in 2 years, transforming mental health care accessibility. In this context, let us talk about Tele MANAS. See, launched on October 10th of 2022 as part of the National Tele Mental Health Program, Tele MANAS, which stands for Tele Mental Health Assistance and Networking across states, offers free 24/7 mental health support through a toll-free number. Significantly, it provides counseling, psychotherapy, psychiatric consultations, and referrals, making mental health care accessible to millions across India, especially in remote areas. Know that in 2 years, Tele MANAS has handled over 14.7 lakh calls, transforming mental health care accessibility in the country. What do you think is the need for Tele MANAS at all? See, India faces a huge mental health crisis, with mental disorders being second leading cause of disability and suicide the third leading cause of death in several states. Notably, over 15% of the adult population requires intervention, yet the treatment gap is 70 to 92%. So, with over 11 crore people suffering from mental health disorders and 80% not seeking help, Tele MANAS aims to bridge this gap and provide accessible mental health care nationwide. If we have to look at the aim and the objectives, see, Tele MANAS aims to provide a universal and affordable and quality mental health care. Its key objectives are, firstly, providing 24/7 tele mental health services across all Indian states and union territories. Secondly, offering counseling, medical interventions, video consultations, e-prescriptions, follow-up care, and links to in-person services. And lastly, prioritizing mental health services for vulnerable and hard-to-reach groups. So on World Mental Health Day of October 10th, Tele MANAS launched a mobile app and video consultation services, initially available in Karnataka, Jammu and Kashmir and Tamil Nadu with plans for expansion. Significantly, the app offers mental health resources, interactive activities, and 24 by 7 confidential counseling. If we have to talk about its achievements, firstly, over 14.7 lakh calls were served in 2 years, then establishment of 52 Tele MANAS cells nationwide, and lastly, collaboration with 23 mentoring institutions and creation of 5 regional coordinating centers to enhance outreach and streamline operations. The third article of the day says that the Delhi Environment Minister on Sunday said that the centre has not yet responded to its government letters seeking approval for cloud seeding to induce artificial rain as an emergency measure to control pollution if air quality plummets to hazardous levels in winter. In this context, let us talk about cloud seeding. See, artificial rain known as the cloud seeding is a weather modification technique designed to induce or increase the precipitation. Know that it is also used to disperse fog banks in some airports. See, in this method, scientists use aircraft to inject silver iodide, potassium iodide, dry ice, and liquid propane or salts into the clouds to mimic ice nuclei. Notably, clouds often lack naturally occurring ice nuclei. So, injecting them with silver iodide particles, which are very similar in structure to ice and other substances, increases the number of nuclei, leading to rains. Then, how does cloud seeding or artificial rain happen? See, the injection of such particles makes the clouds more efficient at generating ice crystals that either fall as snowflakes or melt to produce raindrops, depending on the temperatures in and beneath the cloud. Know that the amount of rain or snow a cloud can produce depends on a balance between the number of ice nuclei inside it and the amount of water available to grow around those nuclei. Now, where is the cloud seeding tested in India? See, IIT Kanpur successfully tested the artificial rain technology over a limited area on its campus. It also tested by different scientific bodies in water-starved regions of Maharashtra, Karnataka, and Andhra Pradesh. The next article says that neither India nor Pakistan has requested a bilateral meeting when External Affairs Minister lands in Islamabad for Shanghai Cooperation Organization heads of the government meet on October 15th and 16th. In this context, let us talk about the Shanghai Cooperation Organization, in short called the SEO. See, the SEO is a permanent intergovernmental international organization established on June 15th of 2001 in Shanghai, but it entered into force on September 19th of 2003. Know that it's a Eurasian political, economic, and military organization aiming at maintaining peace, security, and stability in the region. So, its predecessor was the mechanism of the Shanghai Five, formed in the year 1996, consisting of China, Russia, Kazakhstan, Kyrgyzstan, and Tajikistan. Furthermore, before the inclusion of Belarus, it had 9 members, which are India, Iran, Kazakhstan, China, Kyrgyzstan, Pakistan, Russia, Tajikistan, and Uzbekistan. Then, what are the objectives of it? Firstly, to strengthen relations among the member states. Secondly, to promote cooperation in political affairs, economics and trade, scientific, technical, cultural, and economic spheres, as well as in energy, transportation, tourism, and environmental protection. Thirdly, to safeguard regional peace, security, and stability. And lastly, to create a democratic, equitable international political and economic order. Furthermore, the SEO aims to promote cooperation and mutual support in areas such as the trade, investment, energy, transportation, and security. Know that the official working language of SEO Secretariat is Russian and Chinese. Moving on to talk about its structure. The first one is the heads of the State Council, which is the supreme SEO body which decides its internal functioning and its interaction with other states and international organizations and also considers international issues. Then the heads of the Government Council, which approves the budget, considers and decides upon issues related to economic spheres of interaction within the SEO. Thirdly, Council of Ministers of Foreign Affairs, which considers issues related to day-to-day activities. Know that the organization has 2 permanent bodies, the Secretariat in Beijing of China and the Regional Anti-Terrorist Structure RATS in Tashkent. Notably, the SEO Secretary General and the RATS Executive Committee Director are appointed by the HSC for a period of 3 years. Remember that Kazakhstan was the SEO chairman in 2023-24 and the next SEO summit will be held in China in 2025. The next article says that Prime Minister Modi on Sunday praised the achievements of the PM Gati Shakti Master Plan for multimodal connectivity, highlighting that the initiative in its 3 years has significantly boosted multimodal connectivity, accelerated infrastructure development, and improving efficiency across the country. In this context, let us talk about the PM Gati Shakti. See, launched by the Prime Minister, PM Gati Shakti is a digital platform that brings together 16 ministries, including railways and roadways, to enhance infrastructure connectivity across India. Know that the plan aims to provide integrated, seamless connectivity for the movement of people, goods, and services across multiple transport modes, improving last mile connectivity and reducing travel time. Talking about its vision, see, PM Gati Shakti integrates the infrastructure schemes of various ministries and state governments such as Bharatmala, Sagarmala, Inland Waterways, Udan, and others. Furthermore, it also covers the economic zones like textile structures, pharmaceutical clusters, defense corridors, and industrial corridors. Significantly, the plan uses advanced technology, including spatial planning tools, with ISRO imagery developed by Bisag N to improve the connectivity and make Indian businesses more competitive. Furthermore, there are 6 pillars of PM Gati Shakti. Firstly, comprehensiveness, which means all the initiatives from different ministries and departments will be considered in one centralized portal, allowing for greater visibility and data sharing during the project planning and execution. Secondly, prioritization, through which the cross-sectoral interactions will enable different departments to prioritize projects and more effectively. Thirdly, optimization, which means the national master plan which will help identify critical gaps and select the most efficient routes for transportation in terms of time and cost. Fourthly, synchronization, which implies that the plan will synchronize the efforts of individual ministries and departments, fostering better coordination and reducing the delays. Then the GIS-based spatial planning and analytical tools with 200 plus layers will give executive agencies comprehensive data for better decision making. And lastly, ministries and departments will monitor and visualize the progress of the projects through satellite imagery and real-time updates, enabling timely interventions and adjustments. Now, if we have to see the outcome, we are looking at PM Gati Shakti aims to streamline infrastructure development in India by enhancing interdevelopmental coordination, ensuring timely execution, and improving efficiency in infrastructure planning. The next article says that in a first, the government has undertaken a comprehensive scientific study using ancient and modern genomics to conclusively find the population history of South Asia amid conflicting theories about the origin of ancient Indian communities. In this context, let us talk about the Anthropological Survey of India. See, the Anthropological Survey of India is a premier research institute dedicated to the biocultural study of India's diverse populations. So, as the only government backed organization focused solely on anthropology, it plays a crucial role in advancing both the scientific research and practical applications in the field. Furthermore, with a multidisciplinary approach, ANSI will integrate social, cultural, physical, and biological anthropology through cutting edge facilities, research, training, and documentation. If we have to look back at the history, see, the ANSI's origin date back to zoological and anthropological section of the Indian Museum, which later became the Zoological Survey of India in the year 1916. Then in 1945, the anthropology section became independent, forming the Anthropological Survey of India under the leadership of Dr. Biraja Sankar Guha and Verrier Elvin. Notably, the headquarters moved from Banaras to Calcutta in the year 1948. Then, what about its mission and objectives? See, firstly, to investigate the biological and cultural diversity of India's tribes and communities. Secondly, it is to safeguard and analyze human skeletal remains from various historical periods. Thirdly, to serve as a training and educational center for students and researchers in anthropology. Next, to preserve India's biocultural heritage, including traditional arts, crafts, and lifestyles through anthropological museums. And lastly, to contribute to the collective understanding of India's diverse population through research and publications. The next article says that, notably, barring the pandemic year, this is the most delayed arrival of a poor air quality day for Delhi in October since 2015. So the city's air quality index, which was in moderate category until a day before, touched 224 on Sunday, showed data from the Central Pollution Control Board CPCB. In this context, let us talk about the air quality index. See, the air quality index in India is a tool designed to provide the public with real-time information about the quality of air in their localities. Know that the air quality system categorizes air quality into 6 levels, ranging from good to severe, providing an easily understandable way to assess the impact of pollution on health. So the categories are good, which is 0 to 50, satisfactory 51 to 100, moderate 101 to 200, poor 201 to 300, very poor 301 to 400, and severe, which is 401 to 500. Significantly, the air quality index is based on the concentration of 8 key pollutants, which are particulate matter 10, particulate matter 2.5, nitrogen dioxide, ozone, sulfur dioxide, carbon monoxide, ammonia, and lead. Know that each pollutant's concentration is converted into a numerical scale that reflects its health impact, and the pollutant with the highest score determines the overall air quality index for that location. The next article says that the National Commission for the Protection of Child Rights has written to the Ministry of Information and Broadcasting, asking it to ensure that over-the-top OTT platforms display disclaimers in English, Hindi, and local or regional languages before showing any adult content. In this context, let us talk about the National Commission for the Protection of Child Rights. See, the National Commission for the Protection of Child Rights is a statutory body established by the Government of India under the Commission for Protection of Child Rights Act of 2005. Know that its primary mandate is to ensure the protection and enforcement of child rights for children aged 0 to 18 years across the country. If we have to look at the key principles and focus, firstly it is to promote universality of child rights. C. NCPCR emphasizes that child rights are universal and inviolable. So every child in the 0 to 18 age group deserves equal protection and access to rights without exclusion based on geographic region, community, or circumstance. Furthermore, the Commission seeks to prevent the exclusion of vulnerable children who may not fall into predefined categories. Second one is related to interdependence of rights. See, the Commission views all child rights as mutually enforcing and interdependent. So it believes that a child to fully enjoy their rights by the age of 18, access to entitlements must begin at birth. Thus, policy interventions at all stages of a child's life are crucial to ensuring holistic development and protection. Then, targeting vulnerable children. While the priority actions are focused on the most vulnerable children, such as those in the backward regions or challenging circumstances, the NCPCR stresses the importance of building a broader societal awareness and tolerance for protecting the rights of all children. Now, talking about the structure of NCPCR, it has a chairperson who is a person of eminence who has done outstanding work in promoting child welfare. Then, 6 members who are appointed by the central government, with at least 2 being women. Know that these members are experts from fields such as education, child health, care, welfare or development, juvenile justice and care for marginalized children or those with disabilities, elimination of child labor or work with children in distress, child psychology or sociology, laws related to children. Now, looking at its functions and responsibilities, see, the NCPCR works to ensure that children enjoy their rights fully and without compromise. So, it prioritizes interventions that support vulnerable populations while promoting a broader societal shift toward the universal protection of human rights. Significantly, NCPCR's mission is to foster a culture where children's rights are protected, upheld, and universally enforced. The last article of the day says that the 90% of the funds approved for the scheme of iDEX during 2021-26 have already been exhausted according to the officials. So the Ministry of Defense is seeking to expand the scope of its flagship Innovations for Defense Excellence scheme, which is the iDEX scheme, and sought additional funds from the Finance Ministry to keep it going. In this context, let us talk about the iDEX, which is the Innovations for Defense Excellence. See, it was launched in May 2021 under the Defense Innovation Organization of the Department of Defense Protection under the Ministry of Defense. Know that the objective is to foster innovation, support technology development, and create a self-sufficient defense ecosystem in India by engaging startups, MSMEs, individual innovators, and research institutions in defense and aerospace sectors. Then looking at its key features, firstly with respect to grants and funding, so Spark, which stands for Support for Prototype and Research Kickstart, which provides grants up to 1.5 crore to fund technological projects under the Defense India Startup Challenges and Open Challenges. Then talking about its focus areas, see, iDEX targets projects acquiring low capital investment and high innovation. Furthermore, it also serves as a path for procurement for the Indian Armed Forces as per Defense Acquisition Procedure 2020. Then what about its administration? See, iDEX is managed by the Defense Innovation Organization, which is a not-for-profit entity under the Ministry of Defense. Furthermore, the DIO was founded by two defense public sector undertakings, Hindustan Aeronautics Limited and the Bharat Electronics Limited, and provides policy guidance while iDEX acts as the executive arm. Also know that the iDEX works with partner incubators that provide a mentorship to selected startups or MSMEs, run accelerator programs to strengthen these firms, and promote defense innovations through outreach in academia. Then what about its other objectives? See, firstly, to support the fast-paced development of innovative, indigenized technologies for the Indian defense and aerospace sectors. Secondly, to foster collaboration between the startups and defense, creating a culture of co-creation and innovation. And lastly, to encourage collaboration between the defense entities and the private sector for advanced technology development. To know further about the benefits and eligibility, you can check out the notes posted on our Telegram channel. So, in this video, we have discussed 9 articles in total from today's Hindu, Indian Express and the PIB. We'll be back again with another video tomorrow. Thank you.